Hello, and welcome to the Clinical Care Options Infectious Disease podcast. I'm your host, Jennifer Swanson. Today's episode features content from an educational program titled Shingles in the COVID-19 Era, Shingles Vaccination Guidelines. During this podcast, Dr. Tracy Zivin-Tutela, an infectious disease specialist from Los Alamitos Medical Center in Fountain Valley, California, discusses vaccination guidance from the Advisory Committee on Immunization Practices at the U.S. Centers for Disease Control. For more information on Dr. Zivin-Tutela and a link to the full online educational program, including downloadable slides, please visit the show notes for this episode. So let's get started and hear what Dr. Zivin-Tutela has to say about shingles vaccination guidelines and shingles vaccination in the COVID-19 pandemic.
So hi and welcome to our benefits of shingles vaccination. I'm Dr. Zivin-Tutela, infectious disease physician who happy to, update you on these new and exciting changes regarding shingles vaccine. So let's start with the basics, which is, why do we need this vaccine? And what we know is that as age increases, our immunity decreases. And as we age, this decline in immunity is a dominant driver of shingles. And we know that shingles has lots of potential morbidities that are associated, which we'll go into it in a little while. Previously, we were using the Zostavax Live vaccine, and we learned recently over the last few years that the decline in protection really is dramatically decreased, and that revaccination with the recombinant zoster vaccine decreases that risk of losing that immunity. The vaccine is about 90% effective with the recombinant zoster vaccine, regardless of your age. It reduces your risk of post-herpetic neuralgia, which for most patients we know is the most debilitating part of shingles, and most of us know at least one person who has experienced post-herpetic neuralgia. So who is a candidate for the recombinant shingles vaccine, also known as Shingrix? All of those aged greater than or equal to 50 years of age, 18-year-olds and older that have immunocompromising conditions. And this is new. This is a new update since July of this year. So prior to this, it was only those equal or greater than 50. Now we know that those who are equal or greater than 18 with certain immunocompromising conditions also need and can benefit from this vaccine. Those chronic medical conditions cause a physiologic stress and make them immunocompromised, and those include diabetes, renal failure, rheumatoid arthritis, COPD, and some other conditions. The other patients who are candidates for the shingles vaccine are those who are anticipating or undergoing or recovering from immunocompromising illness. And this can be pre-transplant, pre-chemotherapy, those on immune modulating medications, or planning to go on them. All of these patients are candidates for the shingles vaccine. The ACIP recommends the use of Shingrix in people who are immunocompromised on medications that make them so. 20 milligrams of prednisone or the equivalent. Those with inhaled or topical steroids are using chronically. Those with low-dose methotrexate, azathioprine, 6-MP, other cancer chemotherapeutics, anti-rejection medications. These are all considered immunocompromising medications and put these patients at a higher risk. Those who are anticipating, like I said previously, chemotherapy or organ transplants also would benefit from the zoster vaccine prior to undergoing these immunosuppressive therapies. So let's discuss the recombinant zoster vaccine after a patient of yours has already had the Zostavax Live. So the recombinant zoster vaccine, which is called Shingrix, is recommended regardless of having the previous live vaccine, also known as Zostavax. The Zostavax was live attenuated. It was a subcutaneous one-time dose. At the time, it was approved for those age 60 and older. Shingrix is a recombinant vaccine that is 2 doses. It's an IM injection. It is now approved for those age 50 and older, or those 18 and older who are immunocompromised. It is also now the only approved shingles vaccine in the United States. We found with the research on the recombinant zoster vaccine that it was more effective at preventing shingles and postherpetic neuralgia than the live zoster vaccine. Studies examined the safety of the Shingrix vaccine 5 or more years after Zostavax. No theoretical or data concerns were found to indicate that Shingrix would be less effective or less safe with shorter intervals less than 5 years. So we know that as you age, the Zostavax substantially wanes over time. About 3 years, you have significantly decreased protection from the Zostavax. At those over the age of 70, their immunity waned to about 38%. In those age 80 and older, it waned to about 18%. And so what we learned is with the recombinant zoster vaccine, we had substantial protection beyond 4 years. The recommendation is to wait at least 8 weeks after someone has received Zostavax to administer Shingrix, although this is not really applicable anymore because it was discontinued. So anyone who has received this vaccine is now eligible to get the new recombinant zoster vaccine. What it does is the vaccine boosts our varicella zoster virus-specific cell-mediated immunity. And with routine vaccination, it reduces our risk of herpes zoster and postherpetic neuralgia. The CDC and the ACIP recommend vaccination regardless of whether you remember or don't remember having chickenpox as a child, or your patient remembers or doesn't remember having chickenpox as a child. Although screening is not recommended for this vaccine, some people have been screened for other purposes, such as transplant or other immunosuppressive medications, and they are known to be varicella zoster negative by serologic testing. And for those patients specifically, they should follow guidance with the chickenpox vaccine, not the herpes zoster vaccine. Patients with a previous history of herpes zoster can be vaccinated, and we know that this will help prevent further episodes even if they've already had postherpetic neuralgia. We have learned over the last few years that co-administration with other routine vaccines does not pose a problem. So we can give influenza or pneumovax or any of the other pneumonia vaccines. We recently, as of the last few months, have discovered that COVID-19 vaccine can be given with the recombinant zoster vaccine. It is not contraindicated. When the vaccine first came out for COVID-19, we were recommending all vaccines to not be given within 2 weeks. We now have safety data showing that it is okay. So serious adverse events were reported at similar rates in patients who received the vaccine, about 2.3%, versus placebo, 2.2%. The most common complaints after vaccine were injection site pain, redness, and swelling, along with myalgias, fatigue, and headache. So it's important to educate our patients on these potential side effects and let them know it might hurt a little, but it's not an allergy. So the contraindications to the shingle vaccine are truly only anaphylaxis to any component of the vaccine or following a previous dose. Some other precautions are those who are seronegative status to varicella, because we want them to follow guidelines for the varicella vaccine. We have precautions in pregnancy and lactating women because we don't have established data. A post-marketing observational study found an increased risk of Guillain-Barré observed in 42 days following vaccination in adults over the age of 65. All injectable vaccines have a risk of syncope. Acute herpes zoster infection, we usually recommend waiting until the rash is cleared as a precaution, but if they actively have postherpetic neuralgia, it's okay to proceed with the vaccine. And like all vaccines, if you have an acute illness with fever greater than 101.3 or other moderate to severe illness, we recommend waiting to be vaccinated. So the take-home points are: prior to immunosuppression, we recommend vaccination. Chronic medical conditions such as rheumatoid arthritis, renal failure, diabetes, chronic lung disease should be vaccinated as well. All those age 50 and up are eligible for vaccine. regardless prior zoster vaccination. And we can give it to any patient who's recovered from an acute shingles episode. Again, once the rash is improved, we can proceed with giving the vaccine. There's no need to screen for prior varicella infection, and other vaccinations given at routine vaccinations given at the same time is safe and okay. Thank you for having me. I hope you learned some regarding our new recombinant shingles vaccine and criteria for who needs to be vaccinated.
And thank you very much to you, Dr. Zivin-Tutela, and also to our listeners for joining in. As a reminder, to view the full educational program about shingles in the COVID-19 era, click on the link in the show notes. And please check back regularly for more episodes on important infectious disease topics. Thank you.